live, representing the foremost organization on a daily basis at 7 in the morning Pacific time. You can join us whenever it is convenient for you so we can discuss about the healthcare of the present, healthcare of the future, how the healthcare is is changing, especially because of the pandemic we are facing. So healthcare is going to be revolutionized, folks, no matter what anybody says. No matter if it's a public option, private, public-private partnership, no matter what, it is going to change. So let's be more practical rather than forget about what's going on in Washington, D.C. Let's today's talk. I've spoken about cost of the healthcare and quality of the healthcare. I did talk about cost of the healthcare, quality of the care. The third one, access. Yes, access. Okay, so I need to turn my podcast. Let's start all over again, folks. Welcome to Consumers Doctors Live, representing foremost organization. We do this live streaming on a daily basis, 7 in the morning to for at least for 30 minutes on a daily basis, talk about healthcare issues, healthcare trends, healthcare, you know, changes as we see, especially because of the COVID situation. As we have been hearing about the vaccines, 3 companies have come up with vaccines now. So, but one thing it has changed for good is this COVID situation has changed the trend of healthcare delivery as we see it. So today's topic is access to care. I did talk about the cost of the care. Number 2 is quality of the care. And number 3, which is equally important, is access. This is like a triangle. Cost, care, and quality. There are 3 important aspects, especially when it comes to healthcare. Number 1, increase access to the medical care. Increase access to the medical care. And number 2, improved quality of care. Very important, quality of care, yes. And number 3, lowering the cost. It has to be affordable for all, irrespective of their socioeconomic status, especially focusing on lower socioeconomic status, but it has to be accessible to all. These are the 3 critical metrics. I believe as a consumer's doctor representing foremost organization, it can be achieved through personalized healthcare, folks. Health insurance personalized. It has got to be personalized. So let's dwell more into it and see what it is. How a healthcare insurance personalized will give us the access to the care. Let's talk about it. And it's also hdhphsa.com. HDHP, you qualify to set up an HSA. So it's HDHP HSA. The purpose of insurance is to purchase a protection, like any other insurance, folks, any other insurance, before the onset of a problem. Yes. For example, you can't buy a hurricane insurance when named storm is heading your way. You can't buy it because it's expensive. An imminent potential claim from known pre-existing illness condition generally precludes the purchase of insurance coverage for that risk. So that has been a contentious debate about the pre-existing illnesses. The same thing like buying a hurricane insurance before a storm. Personalized healthcare, we will talk about it. There's a solution in the when the health insurance is personalized. Buying a health insurance is to gain access to healthcare is different. It is different. Pre-existing conditions are prevalent in most of us. Some individuals are born with congenital pre-existing health conditions. Over time, will suffer from accidents and illnesses. Yes. Others will acquire chronic conditions. Still, others must deal with normal disabilities of aging. These are all these conditions. Before this Affordable Care Act came in, so-called Obamacare, health insurance companies used an analysis of medical records and policy applications to profile individuals or groups in seeking health coverage. Yes. Insurance companies wanted to determine the extent of any pre-existing sickness or illnesses. This is called risk selection. Again, broad category, risk selection. It is very broad, folks. It is not segmented. You're talking about risk segmented among the entire population of 320 million. You can't do that. You just can't do that. When you say risk pooling among the entire country, it just doesn't make sense. You need to segment it. Like as I mentioned earlier in my broadcast, there is well category, at-risk category, chronic illness category, catastrophic. These are the four. You need to segment those risks among those categories. You cannot just say, hey, we are going to give you the premium based on an entire population of uncompensated care provided by the hospitals, doctors. It is just costing the country. And we can't do that. We cannot. We need to segment it. We need to focus our attention on the people who need the most. Risk segmentation does that. And personalized healthcare delivery does that. So before Obamacare, most states allowed health insurance companies unilaterally deny individual applicants or groups access to purchasing health coverage. Yes, most of the states did that. And many insurance companies abuse this risk selection power by cherry picking only the healthy consumers. You can't do that. If you are going to do it, segment it into the well category, lower their premiums. And at-risk category, categorize. I want to see them transparent, these insurance companies transparent in each category, like what they are doing this Medicare Advantage advertisement bombarded. I would like to see the insurance companies advertise. Well category premiums are $200. At-risk category is $400. Chronic illnesses is $600. They need to be transparent. They need to be. That's how we can take care of the sick. That's how we can take care of the sick people, and we can focus on it. You cannot you cannot put well category into the chronic illness category and raise everybody's premiums. You can't do that. Insurance companies knows that, but they don't want to talk about it because they are lobbyists in Washington because they want to make profits from everybody. So they can show it in Wall Street. So their share prices cost, everything goes. And it costs every time they do this. That's why I want consumers to be in the front line, folks. Consumers to be in the front line. In general, limiting health insurance means limiting access to medical care. That's in general. Limiting access to health insurance means limiting the access. That's as simple as that, folks. How are you limiting the access? By denying it. By denying it. This is what the access to care is about. Who needs the most? Personalized health insurance empowers consumers, empowers the consumers, and assures access to affordable health insurance for all Americans, irrespective of class or creed. No bronze, no platinum, no gold. These are class. Why divide into bronze, platinum, gold? This is stupid. Yes, it's stupid. Basing on their economic, you're basically blacklisting the lower income categories, folks. That is just not right. People who really need the most care, you're not focusing on them. You want to give them the stupid Medicaid card and bronze card. That's worthless, man. That's worthless. Those bronze coverages are worthless. Medicaid is worthless. Medicare for all is worthless. You're not giving the power back to the people. Individually, consumers have to be in the front line. These lobbyists have gone after these politicians. They're covering their butts. That's what they're doing. They want to make money off of you guys, of all Americans. Why can't they segment it and make focus on well category? Give them those premiums, man. People who need the most, if they're in the chronic illness category, give them the premiums, how much it is. You tell us. If there are 20% of the people have chronic illness, give them the $600 instead of $200. Just tell us up straight, and state can subsidize it. And we can focus on those people. That's what they need the most. People with at-risk category, people with chronic. We need to focus on them, man. I don't know how else to say it. It is frustrating when people are, every time you talk to this representative, they say comprehensive policy. That's stupid. There's no comprehensive policy. Just give the policy, give the consumers what they need instead of giving a bronze category, Medicare, Medi-Cal. They're worthless. Bronze. Why bronze to a few people and why gold to few people? You're creating a class system. If you guys are listening, you're creating a class system among Americans. This is just not right. You cannot create a class. Everybody is equal in this country. I came from a poor country, and you guys are doing the same thing what I saw it back home in India. Britishers created this class system. They are doing the same damn thing here in this country. They need to change that. You need to have a personalized health insurance for all Americans equally, especially for who need the most. They can be subsidized by the state and federal government and focus the attention on them. So pre-Obamacare study, so-called American health insurance plans, showed 88 to 89% of the health insurance applications went through a medical underwriting process, resulted in offer of coverage. I'm sorry. It's upsetting when people do this. Every time I hear this, you know, you're creating a class system. In United States, you want to create a bronze and platinum and gold. What the hell is that? So insurance companies called offer of coverage. Significant number of applications for individual health insurance never even made it to the medical underwriting process, folks. This is the beauty. They never even made it to the underwriting process because of the pre-existing conditions. Some applications were not even processed because of lack of citizenship. And they want to cover for all. You can't even take care of your own Americans who need the most. And I understand magnanimity, all this. People want to be broad-minded, and I want to help your people, your legal citizens in this country. I can understand what you want to do, you want to achieve, give a broad to the. So they didn't even make it because of a lack of citizenship, and they denied non-medical reasons. So whatever it is, so these are the people when they go to the hospital, uncompensated care. Hospitals by EMTALA law, they have to provide the care. This is the government job to take care of them. Hospitals doesn't have to follow the EMTALA law. I would like to scrap that. EMTALA law belongs to the responsibility of the hospitals. They don't have to follow the law. They need to be scrapped. They need to get paid for whatever they provide the services. You can not pay and force the hospitals to provide an uncompensated care. That's what the cost of the care is going up and premiums are rising. Why can't you address that in Washington or in Sacramento? Address that before you punish people, average, low income category, before you say public option. You want to raise taxes, but if it's doing any good, yes, but it's not solving the problem, folks. It's not solving the problem. So acceptance rates varied by age. Acceptance rates varied by age. Insurers accepted 95% of the people under the age of 18. That's the beauty, man. They accepted because that's where the money is coming in, because they never see the doctor, they never go to the hospital, and their premiums are also there. They're making money off of this under 18 people age for their insurance coverage. 71% of them people ages 60 and 64. So they accepted under 18 only 71% among this 60 and 64. Older folks were more likely to be rejected from pre-existing conditions. Yes. Over all ages, 2 to 3% were deemed uninsurable. Uninsured. Who is making these decisions? This is from the insurance carriers. Where is the consumer in all this? Where is the consumer? How come you're not engaging with the consumer? In total, 12% of the applications were rejected. For medical reasons, folks. Medical reasons, purely medical reasons. And they need the care the most. That's the part we're not even addressing that. That those 12% of this people under the personalized health insurance will get the access. Yes, they will get the access at affordable coverage they need and to cover the pre-existing conditions. They're the one who need the personalized health insurance. Those 12% of the people rejected by the insurance companies, they are the one who need the most care because they are the one costing Everybody, folks. That's what the premiums keeps going rising because they are being denied. These critical 12% of the applicants who are denied do not come from any one set of employer plans or from any particular sector of the society. Many are working small businesses, work multiple part-time jobs. These are the people, multiple part-time jobs, and are self-employed. And these are the people they were denied. That's the beauty, man. This is, nobody looks into that. And those are the people who need the most. And they are the one who need the care. And they're all self-employed, hard-working Americans. And they need personalized health. And they get the access if you give them the personalized health insurance. Yes. You give them the certificate of guaranteed coverage. And give them through the health review board who were denied health review board through public-private partnership. They will get the coverage and they will get the best private coverage you can get. Instead of this bronze, instead of this gold, platinum. That's nonsense. You're literally creating a class system. There shouldn't be any class system in healthcare, man. There should be. If we can't do the list, this is, you're talking about United States of America. You want to create a bronze, gold, and platinum. I just can't, every time I look at it, am I really in America or am I in India? Anyway, personalized health insurance addresses these issues who need the most. And these are the folks left behind, unable to purchase insurance. Those are the people they need the personalized health insurance. Access to care passes with flying colors, more. Flying colors. You're talking about personalized health coverage to the lower income, to the chronic illness people who were denied by the healthcare. Why can't they look into it and they get the best? It passes with the flying colors, man. I don't know what comprehensive solutions they're talking about. Why don't you give the coverage to need the most, who were denied by the pre-existing? Instead of punishing all Americans who are healthy, they hardly ever use it. By segmenting it, healthy folks should have a lower premium. At-risk folks should have a different premium. And chronic illness have a different premium. And give them this certificate of guaranteed coverage. The secret here is that access to affordable health insurance provides access to the, that's the secret, provides the access to the care. Right now, Medicaid, and they're afraid because there are co-pays, deductibles. There are all hidden charges, folks. Everything is all hidden. And there is still out-of-pocket expenses. The people can't afford it. So this simple concept, access to care, is best provided by personalized health insurance, man. We need personalized health insurance to all Americans, especially those 12% who were denied by denied by the insurance company. They need the most coverage because they are the ones seeking the coverage. I'm sorry, I know I get excited when people don't, understand it. This, I got this from an actuarial, folks. This is from Ron Bachman. He's an actuarial represented in Washington, D.C., in front of the Democrats, in front of the Republicans, among all the states he represented. Even he's the one who pioneered the mental parity law. I admire Ron Bachman. If you're listening, I'm trying to, he should be I would like to give him Medal of Freedom Award. If if we go through this, we need this personalized health insurance. We need the most now, not bronze or not gold or platinum. We don't want bronze, gold, or platinum, Medicaid, Medical. You can't segment, you cannot create a class system, folks. You need to give them the personalized health insurance for all Americans. If you like this channel, keep subscribing to this channel. I'll be talking about more and more about healthcare issues and uh, modern trends, which is healthcare is changing, especially because of the COVID situation. And I would like to see, I will be talking about the modern trends in healthcare. And what I see is there's so much going on. I am a robotic surgeon. The technology is just amazing. And telemedicine, telerobotics, teleradiology, artificial intelligence, it is just going to change. It's going to change folks. So I would like you to engage with you guys. And I would like to hear more comments. And share the channel and hit that notification button, folks. I love you guys. I love interacting with Americans. I wish I get the chance because I'm still trying to learn how to chat with the folks. I wish somebody can help me out. I'm trying. I haven't had any. I'm going to try to set up this chat and make comments on individual opinions. I'm sure there are a lot out there. I love the negative comments because that makes me stronger. It's not like you have to commend this doctor doing this. I don't need any comments. I need to help average folks. This is my passion, to have the healthcare delivery, access to care to all Americans, irrespective of their socioeconomic status, color, or creed, or sex. It doesn't matter. We all need personalized healthcare. We will see you tomorrow at 7 a.m. sharp. Thanks again, folks.